Hi, I'm Dr. Cluff, and I'm going to talk to you today about presenting the Cluffy Wedge to your patients in your office and how I do that in my office. And it's a relatively simple thing for me to do. And I wanted to try to help you as well to understand when you're going to use this and how to use it properly in your office. As you know, first ray function is extremely important. It is one of the things that I think is central to proper orthotic correction. We're often concerned about first ray function with plantar fasciitis, with lesser metatarsal overload, Achilles tendon problems, many other mechanical issues you're going to see with the foot. So it's something that I use commonly in my practice because I find stiffness of the big toe joint to be present about 90% of the time when I see a patient in my office. And this is a very reliable way that I can treat this and overcome that stiffness. And I think it's an integral part of every orthotic correction when people present with those with that stiffness or that functional hallux limitus. So I'm going to go through the presentation with a patient today and just show you how I explain that to them and how we put the product on their insole and walk with them and so forth. And hopefully you'll gain some good insights from this video. I hope you enjoy it. This is Nancy, and she's coming in today complaining about pain right here in the ball of her foot, and she does have a functional hallux limitus. So I'm just going to explain that condition to her. Okay, now Nancy, your problem is primarily here with your pain is right here, but this is really a big toe joint problem is what you have. And I'm going to show you how the foot basically functions. So when you first come down on the foot, your foot is a shock absorber, and it adapts to the terrain, and it absorbs shock from the step. And as you move forward, your big toe moves up like this, and when it does that, it's like a switch, and it converts your foot from a shock absorber to a rigid lever. So now your foot is really rigid and stable, so as you move forward for the next step, you can move forward efficiently. It's like you know, moving off a stable platform versus a real loose platform. It's a lot more efficient for you to move forward on a stable platform. Okay, so you can view your big toe as like a switch. It's taking your foot from this very unstable position to a very stable position, and that happens all by virtue of the fact that your big toe is moving up and down. And your big toe moves up and down just fine like this. There's no arthritis in the foot or anything like that. But as soon as I put a little bit of pressure here on your big toe, you see how there's a lot of stiffness in that big toe joint? Do you see that? How that gets real stiff like that? Okay. Now, because it's stiff like that, this cannot change then from that shock absorber to that rigid structure. So what we're going to do is we're going to unlock your big toe joint now. Okay, and allow that to move. Do you see how now it's moving fine? And here it was locked, and now it's moving fine. You see that?
That is incredible.
Yeah. Okay, now what I did to do that is I just pushed your big toe up a little bit like this before I push here, and that allows your big toe joint to move without restrictions. Okay?
That's unbelievable.
So what we do to obtain that correction now is we're just going to put a wedge underneath your big toe, bias it up just very slightly, and that will allow that big toe to bend properly. Now the significance of this is, what I want you to see is this. When I have your foot in a shock absorbing position like this, you see how this metatarsal is relatively upward, and as I move the big toe up, I want you to see what happens to that metatarsal. Do you see how it comes down into the floor?
Yes.
Okay, so if I can't move that big toe joint upward like this, if it's stiff, that metatarsal can't come down into the floor and bear weight. So normally, you know, this metatarsal would bear a lot of weight, but because it doesn't come up, because it doesn't come down properly, because this big toe joint is stiff, it doesn't bear the weight that it should, and a lot of weight's being transferred over here to this metatarsal, right over there. Okay? So what we need to do now is we need to get that joint moving, and when we do that, that metatarsal is going to come down, it's going to start accepting more weight, and that will result in some significant weight reduction or stress reduction in this part of your foot. Okay? So that's what we're going to do. Does that make sense to you?
Yeah,
do you understand that?
It does. It makes total sense.
Okay. All right, so that's the thing that's wrong. Even though the problem is over here, your pain is here, it's a primary problem with big toe joint motion here. Okay, so what we're going to do is we're going to give you an over-the-counter insole today with the wedge attached to the insole so that you can transfer this from one shoe to the other, okay? Now, this is going to be something that insurance is not going to cover. It's going to cost you about $75 for the insole with the wedge. Is that okay for you today?
Yes.
Okay, now these do not work in dress shoes. They're going to work in regular walking shoes, but when you have that wedge in your toe underneath your toe now, so that's going to take up some room. So you're going to have a shoe that has enough room in the toe box to accommodate for the wedge. So dress shoes generally don't work. Some dress shoes will, but you just have to look at the toe box and make sure you have enough room in that toe to make sure that the wedge is accommodated well. Okay, now what I'm going to do is use the Superfeet, and you can use any over-the-counter insole for that purpose. It just has to have the full length so it extends all the way out underneath the hallux or the big toe. So we're just going to be taking the wedge, and it has an adhesive backing on. We just peel that off. It's very easy to adhere this then to the insole, and this just goes right underneath the big toe. Now we're going to do this, of course, after marking the toe to determine where the toe actually sits on the insole. But that's how it ultimately looks without a bunion. You want this wedge just to contour the inside of your insole. So this just takes a second to put this on. The adhesive is very sturdy. It'll hold that on without moving once it's on there. Now we're going to just take the liner out of her shoe because the liner plus the insole is going to be too much in there for her. Okay, now we're going to walk with her. Now we're going to have her just walk down the hall. Nance, just walk your normal. Just show me how you normally walk. Okay, now what I'm looking at right now is I'm looking at she's not using her big toe at all. She's not using the windlass mechanism. She's not engaging that. That's probably a compensation from the fact that she's had a functional hallux limitus or just a lack of motion there, and she's not really using the big toe at all. So that being the case, she really doesn't have a windlass mechanism that's working at this point. So Nancy, what I'm going to have you do now, I'm just going to have you walk faster down the hall. I'm going to have you take a longer step, and I want you to feel like you're rolling right over your big toe. Okay, I want you to walk a little faster. Okay, little longer step. Okay, and I want you to feel like you're rolling right over your big toe. All right, keep going. Okay, come on back. A little faster now. Faster. Faster. Okay, I tell my elderly patients that what they really need to do is they need to walk faster, they need to take a longer stride, and they need to think about rolling off the ball of their foot right over the first metatarsal. A lot of my patients come in and they're very antalgic, they're walking very slowly, they're kind of stepping, and they're not really scooting along. They're certainly not in a propulsive gait pattern at all. But the other advantage to getting them to function that way, of course, is you're engaging the windlass mechanism, but you're also making them more stable. And as they walk faster, I tell them it's like riding a bicycle. As they go faster on a bike, it's easier to balance versus going slow. So we're trying to increase their speed and increase their stability in addition to improving function through engaging the windlass mechanism. Okay, Nancy, do you feel any difference when you're walking down the hall like that? Do you feel like there's less pressure on the ball of your foot? Do you feel the pressure underneath your big toe?
Yes, I feel that, yeah.
Do you feel that?
Mm-hmm.
Okay. All right, that's normal. That's good. That's what we want you to feel. We want you to feel like there's less pressure on the ball of your foot right now. So now this may be a little uncomfortable initially. This will take probably a few days to break in. After 2 or 3 days of wearing this, you probably shouldn't even know that it's there. Now the other thing we want to do is if you have sandals that you wear frequently, we need to put this on your sandals. And this will give you that correction in the sandal and allow that big toe joint to move. Even though you can't wear those insoles in your sandal,
right,
it'll still allow that big toe joint to move, and you're still going to get the correction of the wedge. Mm-hmm. So what I want you to do, when you come back to see me in about 3 weeks, I want you to bring any sandals you have that you wear frequently. Mm-hmm. And we'll go ahead and we'll put that wedge on the sandals for you at that time. Okay, so then what I want you to have that wedge in your shoes at all times. It needs to be a very consistent thing for you, okay?
All right.
Okay, good. All right, well, we'll set up another appointment then for you in about 3 weeks, okay?
Great. Thank you, Doctor.